I met a really interesting man in the clinic this week. A very healthy gentleman, non-smoker, non-drinker, exercised all of his life, fit as a fiddle, lean as you could imagine. But of course he was in my clinic for a reason, and that was because he had developed coronary artery disease, or furring of the heart arteries. And his simple question to me was, "Doctor, how has this happened to me?" Well, when we looked at his past medical history, we pulled out some really important things. His father had had a heart attack in the past. His mum had had a stroke at a very early age. He had a strong family history. And then, of course, when we examined him, we noted that he had high blood pressure that had not been treated for most of his life, had not been detected. He had high cholesterol. It was over 8, which he had not known about. And of course, the first thing we wanted to do is deal with these risk factors, to control his blood pressure, to deal with his cholesterol by one means or another, to lower it, to reduce the risk of him developing further problems down the line, whilst we indicated to him an immediate treatment to improve the blood supply of his heart. Now, of course, had he known the importance of genetic history early on in his life, had he known perhaps in his early 30s that his blood pressure was out of control or that his cholesterol was high, we as doctors could have done so much more to reduce the risk of him developing heart disease in his 40s. So it's really important, if you've got heart disease in the family, that you go and see your doctor and ensure that you don't have any risk factors specific to you that are going to perpetuate, potentiate, precipitate, speed up the development of heart disease or furring up of arteries in your body. And I say, for everybody, genetic history or not, it's really important that when you reach adulthood that you get used to measuring your blood pressure regularly. I say rest for 5 minutes and measure it perhaps once a fortnight or once a month. And if it's persistently high, then you need to go and see your doctor and he can check it and then prescribe you the right medications, because without good blood pressure control, you are going to run the risk of cardiovascular issues. And of course, if you're not eating healthy and you put on weight, you're at high risk of developing diabetes. Your blood cholesterol, if it's high, we can do things to lower that, either simply through dietary means or with the use of statins, if you are able to tolerate them. So don't ignore family history. Don't wait for something to happen to you before you start doing something, because we can make a big difference. We're beginning to realize as doctors if we intervene at an earlier stage in your life. I hope that was helpful to you. We will be putting some videos out shortly about the top 5 foods that I would recommend that you ate, and perhaps the top 3 foods that you should try and avoid at all costs. Bye for now.